Serious illness can strike at any time. For a young Oxford County couple and their 2-year-old son Bryson, a painful leg led to a life-changing situation.
Right before he was diagnosed, I was teaching, and TJ was staying at home, just working part-time as a police officer. So I was up and out in the morning, and he was home with Bryson, taking care of him and playing and go and do a lot of things. We were always out at the park or taking him places. We were pretty active, taking him hiking and stuff. So living a pretty, what we thought was normal life.
I put him down for a nap. And when he woke up, I picked him up and I changed his diaper and then put him down on the floor. And once I put him down on the floor, he cried. I said, ow, and kind of, favored his left leg. It was a week later. It was a Saturday. We were at her mom's house, and then he started kind of limping and favoring the leg again. And it was late. It was late Saturday night, so we decided if it was still acting that way in the morning, we would bring him up to the hospital. So Sunday morning, he was still acting like he was in pain. So we went to the walk-in, and they took an X-ray. And then they came in with the X-ray and said, we'd like you to go to the Boston Children's. They said it's possible, one of the possibilities that it might be tumor.
How about that?
And that's when it all kind of snowballed.
Over the next several months, Bryson underwent radiation and chemotherapy, and also had to wear a body cast. When he was released from the hospital, visiting nurses was there to help them transition to the home setting.
Home health nursing and the professional nurses that visit patients and families in the home setting are there to help those patients transition from a very acute or crisis-oriented episode or event that puts them in a hospital or acute care setting, and now they have the opportunity to transition to the home. And in doing so, there's many ways to make that happen and to support that patient and family so that it goes smoothly and hopefully without complications. But also, it's teaching and educating the family how they can help their loved one return to an optimal level of wellness.
I was aware that nurses went to the home and cared for people, but that was about it, just the general. There are nurses that go to the house. Nothing.
I didn't
more than that.
Really understand, I kind of thought, this is my home, this is my child, what can a nurse do for me in my own house? And so I knew they did it, but I didn't really understand what they did and how they helped.
I think peace of mind goes a long way, and knowing that the visiting nurse is coming makes things a little easier. She can come, she knows what's going on with him, and they put a lot of effort into knowing their patients.
It was nice to, I know for our nurse, and I think probably everyone who works there, I could call anytime. It didn't matter if it was her day off, her day on, it didn't matter if it was morning, night. If I had a question, if I was worried, I could always call her, and she always took the time to listen to what I had to say, to think about him specifically, and let us know, what she thought.
So, for example, if we have a child who may be an 8-year-old who was previously in a good state of health and had surgery for some reason or was born with a condition that necessitated surgery, our nurses could help that patient and family transition to home. So we might be talking about medication teaching, we might be talking about a dressing change, maybe we're talking about catheters, maybe we're talking about IV antibiotics, maybe we're talking about drawing blood or doing tests or procedures that help keep the patient in the home setting and often allow the patient to return to their normal routine with this kind of nursing support in the home.
We're constantly on him, and we get just as much exercise as he does, which could be a good thing. But he's a very strong little man, which is why he's going to be Superman for Halloween. He is our little Superman. It's pretty fitting for him. So it's funny, something that would knock us down for the count. He's the strength that comes from him, he actually gives us our strength that we need to support him, which is funny. So he's strong enough for himself and for us.